Live from Town Square Towers at the heart of the Jersey Shore. Wake up with Jeremy Grunin. Get up, get out, do something. Join the conversation. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
All right, welcome back. Wake Up with Jeremy Grunin here with Dr. Yolanda Tammaro. So, Yolanda.
Yes.
So when it comes to breast health, what are some of the key points of care?
Okay, so really what's most important is early detection. So, we want to perform screening on all women, and we do that with mammogram. And we start at age 40, and then get a yearly mammogram after that. And, in addition to that, it's certainly important to get a clinical breast exam. So that's where you go to your internist, OBGYN, or your breast surgeon, and they perform a real thorough exam of the breast. And that helps to increase finding a potential breast cancer. So once that's performed, you can also have the option of doing something called a breast self-exam, and that's where you actually check your breast yourself. So we generally say to do this approximately one time a month. And what you're doing is you're getting a feel for your own breast. So a lot of breasts have lumps and bumps, and that's normal. But the more you do the exam over time, the more you get a feel for what is normal for you. And if you feel something unusual, then you can bring that to the attention of your doctor. And you're also looking for different things going on with the breast, like not only a lump, but, is there any redness to the skin, or does the nipple look different? Is it being pulled in, which we call nipple inversion? So all of those things increase early detection. And early detection really is key because that's where we can perform surgery to potentially preserve the breast, which is really important to a lot of women. And that's where you're going to get your highest chances of cure. When we find it early, we increase the rate of which we can cure patients. So early detection really it's just key.
Right. So do we have any kind of statistics around survival rates, early detection versus non-early detection, or what does that look like?
Yeah. So the earlier that cancer is detected means it's at an earlier stage. So when we approach, the earliest stages, we can get up to a 99% chance of cure, or a 5-year survival rate, as what we call it. And that means surviving 5 years after a breast cancer diagnosis. So it gets, the earlier you detect it, the higher your rates are. And, you almost approach 100% rate of 5-year survival, which is really excellent. And that's because of the advanced treatment options that we have now. That's certainly because of early detection. That's also because of increased awareness. We have lots of different forms of awareness increasing, like, ads on TV, races for the cure, paint the town pink here. So, that all definitely makes the women of the community know that it's certainly important to get these screening mammograms and to come to your doctor once a year and get that clinical breast exam, because that's what's going to increase your chance for cure.
So I'm sensing, listen, I don't mean to call you out, but I'm sensing a little reverse sexism here, because didn't I hear somewhere that men can get breast cancer too?
Yes. So
how would I go? Like, am I supposed to get I'm 42 now. Am I supposed to go have that checked, or what do we do?
So male breast cancer is very rare, but
Okay.
It does happen. And usually what happens is you'll notice something different. You'll notice like a bump or a pain in the breast. Usually pain in the breast does not mean cancer, but something will bring awareness to a lump in the male breast. And if that's found, then, you go to your doctor, and the doctor will refer you to a breast surgeon, and we will get a mammogram. But to get a screening mammogram on all men is just, it's not ideal, because what's going to happen is you're not going to find enough cancers,
right,
essentially. It's just so rare. But yes, it is definitely something that can happen, and men need to be aware of that. And so if they feel anything out of the ordinary or see something different, the skin looks different, there's some redness, the nipple looks different, there's some discharge from the nipple, you should definitely get that checked by your doctor and be referred to a breast surgeon who will ultimately get you a mammogram.
Okay. All right, good. I just, this isn't, by the way, one of those things that I need to be on equal footing on. I'm just saying. I mean, that one we could pass on. So how did you, I mean, I like to ask doctors how they decided kind of which specialty they get into. Because I know at some point, I wonder sometimes if there's some kind of seminal event in someone's life or something changes and that it kind of creates a passion for a particular discipline. So I would love to hear your story, but we only have 1 minute till after the break. So can you hang with us for one more segment?
Sure.
Okay, because I'd also like to know about treatment options and a little bit more about the approach to care at Meridian Cancer Care, et cetera. So thank you so much. That would be really great. Dr. Yolanda Tammaro from Ocean Medical Center, breast surgeon there at Ocean Medical Center, talking about breast cancer awareness and treatment. So we'll be back with more Wake Up with Jeremy Grunin after this break.
The news is next. Live from the WOBM Newsroom, the Town Square, New Jersey News Network, and Fox News Radio. Wake up with Jeremy Grunin. News Talk Radio WOBM AM 1160 and 1310. Live from Town Square Towers at the heart of the Jersey Shore. Wake up with Jeremy Grunin. Get up, get out, do something. Join the conversation. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Hey, welcome back. Wake Up with Jeremy Grunin. We are back with Dr. Yolanda Tammaro from Ocean Medical Center. She's a breast surgeon there. So Yolanda, tell me, how did you decide that you wanted to kind of make this your focus?
Well, I knew that I wanted to be a cancer doctor from the time I was young because my mother was stricken with lymphoma, and I watched her go through the battle, and I was just really amazed by the doctors that she had and just how compassionate and intelligent they were and how they just fought so hard to try to cure my mother. And that really inspired me to become a cancer doctor. And once I knew I wanted to be a surgeon, during my surgical rotations, I was exposed to breast surgery. And that's where I really developed a passion for breast cancer. And I really enjoyed working with the patient population. I enjoyed working with women. I thought that, it was really very special to be the leader of the pack. So essentially, not only are we performing breast surgery, but we're making sure that we know a little bit of everything. We need to know if the patient needs radiation, and we need to, send them to the radiation doctor, make sure they get there. And the medical oncologist, we need to make sure that they know what treatments lie ahead of them after surgery. So I liked the approach, that multidisciplinary approach. I like thinking together with other specialties. And I just love the patient population and, of course, the surgeries that we perform. I really thought they were special and just really enjoyed doing them every day.
That's great. And by the way, it's so much better answer than the one I got from the colorectal surgeon I had on last week. So moving right along, what are some of the treatment options when, unfortunately the reality hits?
Right. So they'll usually come to me first, and oftentimes surgery is the first line of treatment. And so we perform multiple different surgeries. Each patient is different. So the main surgeries that we perform are either a lumpectomy or a mastectomy. So lumpectomy is where we remove the tumor and a normal rim of breast tissue around the tumor. Mastectomy is where we remove the whole breast. There are lots of options with mastectomy now. Unfortunately, some women need to get mastectomy. Some women prefer to get mastectomy. So we can offer mastectomies where we spare all of the skin or where we spare the nipple and the areola for better cosmetic result. And that's, for a certain patient population, that's an option. And we have really great reconstruction options now. We can either place an implant or we can use the woman's own tissue from their belly or their back to create a new breast, and that's done by the plastic surgeon. So, the main thing that we do, we either preserve the breast or we remove the breast but reconstruct a new one with plastic surgery. And then there's some women who aren't interested in reconstruction, and that's okay too. So clearly it's not the decision only of the breast surgeon. Unfortunately, sometimes you're kind of cornered into one decision, but oftentimes there's a choice, and we work together to try and figure out what's the best option for you.
Great. And so overall, I mean, what should people know about the overall approach to care and what they can expect from the Meridian Cancer Care team?
So the overall approach to care is, again, a multidisciplinary approach. So we're working together with other fields, not just the surgeon. We're working together with the radiation doctors, the medical oncologists, the radiologists. We're working together with nurse navigators to make sure that you actually get the care that you need and you know where to go and you know where you need to be at certain days and certain times. But, my approach and Meridian's approach is also an individualized approach. So it's very important to recognize that everyone is different and everyone has different preferences and goals and desires. So especially when it comes to my part, I'm really going to take into account not only what my advice is, but what the patient is really desiring. And that's, there's a choice oftentimes, and it's difficult to make, but that's why I'm there, to try to give you the most information that you can possibly absorb in order to make the best decision for you and for your personal life and what you're going to be most comfortable with.
Great. So Dr. Yolanda Tammaro, breast surgeon, Ocean Medical Center. So I want to kind of sum up, if I may.
Sure.
I like to do this kind of as a recap for those that may have only caught a portion of the interview, or just maybe their heads were spinning from so much great information. So I want to give you my high points of what I got out of this. So number one, the more heads, the better. Thought that was an interesting point. So I wanted to write that down. I wanted to also write down that if you live in Staten Island, you consider Belmar and Point Pleasant the Jersey Shore. So I got that. All right. So those are my two big takeaways so far. And of course, the third one is the fantastic quality of care at Ocean Medical, especially as it pertains to the Meridian Cancer Care team at Ocean Medical, and especially as it pertains to the breast surgeon there, Dr. Yolanda Tammaro. Thank you so much for joining us this morning.
Thank you for having me. It's been wonderful.
Absolutely cool. And please don't forget, I don't mean to put any pressure on you, but our all-time most views on our YouTube is like 226 right now for any one interview, and that is actually someone from the Meridian Network. Right. So I'm just saying, I mean, listen, I don't mean to I don't want to turn this into a popularity contest. I don't mean to really reduce it to the lowest common denominator. But, I think if people really do care about you, they would go and watch the YouTube is all I'm saying. OK,
I got it. Yeah. And I am a little competitive. I am.
Well, there you go. So the gauntlet has been thrown down. Dr. Yolanda Tammaro, thank you so much for joining us. We'll talk again soon. OK.
Thanks, Jeremy.
All right. Be right back. More Wake Up with Jeremy Grunin.
Stay tuned for Preferred Company with Joel Markell and Marianne Levy at 8. Wake Up with Jeremy Grunin continues next. News Talk Radio WOBM AM 1160 and 1310.